And we're back talking about Canada's healthcare crisis and what can be done to improve the situation. Nadeem, before the break, you were talking about something called activity-based funding. This is a concept that some viewers might not be familiar with. So could you give us a quick briefing on how it works and how it's different from, say, the status quo?
With pleasure. Currently, hospitals across Canada are generally funded under a program or a model known as global budgeting or block grants, which means every year the hospital gets a big bag of money from the government and is told to go look after people. That's administratively very simple, but it doesn't really give the hospital any incentive to treat more patients or to see patients more efficiently. Activity-based funding flips the system on its head. Instead of having every patient drain the budget, it actually ties the money to the patient's arrival at the hospital. So it's money following the patient. All of a sudden now, as patients are bringing revenues to the hospital and the hospital's not getting revenues for not seeing people, it is the incentive to see more patients and see them more efficiently is created and significantly enhanced. So it's as simple as money following the patient to the hospital door instead of simply paying the hospital to exist. And it has proven to be a very effective funding model across Europe, everywhere it has been tried. And in fact, Canada is one of the very last developed nations in the world with a universal access healthcare system to implement activity-based funding for hospital care. And even then, we're only doing it in Quebec, really.
Yeah, and on that note, Emmanuel, I know you've been tracking this type of model, the activity-based funding approach, not only in Quebec but beyond our borders too. What have you observed with this type of funding model in Quebec so far?
Well, one of the reasons why it's so important is that right now, being efficient is basically punished by the system. Hospitals, I'm talking about. For example, in Montreal, we had a hospital called the Montreal Jewish Hospital, and some years ago, it was known to be very efficient because it had different methods, different management methods, and different ways of doing things. So they were so efficient, and when it made the news, then everybody started going to that hospital, and then it was a victim of its own success, and then it became as backlogged as everywhere else. So with
Mm.
activity-based funding, you're rewarding the hospitals for being more efficient. And in Canada, in Quebec, it's being implemented, and the goal for all surgeries to be funded through activity by the end of the year. And also the goal is to have all physical care being funded with activity-based funding by 2027 and 2028. So we have some of it already being attempted. We have some of it, for example, for our MRIs that was implemented in 2017. And the results of that is they've seen that the volumes of patients, they've been able to see 22% more people, and they've seen a
Mm.
reduction of cost of 4%. So it really shows that it is working, even inside the borders where not much of it is done. So if we could apply that across the board in our healthcare system, it would definitely be beneficial for everybody.
Those are pretty fascinating numbers to hear that output's gone up and costs have gone down. Um, I'll ask this question to both of you. Are other provinces looking at that Quebec example and saying, maybe we should do that here? Nadeem,
I think
have
as we
you
look
seen any?
I think as we look across Canada, we've seen provinces try a little bit ahead of Quebec, but really not get anywhere. There was an experiment done in British Columbia, a pilot project, ran for a few years, generated positive results, as you would expect. I mean, this is a reform where in Sweden they found they could deliver 10% more care for 1% less money post reform. So it's going to work. The record is clear. Trialed in BC, and then that was the end of it. Ontario said they were going to go down this path. They created this new, more complex hospital funding program, which effectively added up to a very complex mix of global budgets with some activity-based funding, but not really a meaningful component. This is really Quebec leading the charge, I think, for other provinces. I suspect there's probably some politics in the background suggesting to politicians they shouldn't try it for fear of upsetting the public or upsetting the defenders of the status quo. And it'll be very interesting to see the data coming out of Quebec to show that this is a process that really does work, as it has worked across the developed world. Again, we're the last country in the developed world, or one of the last 6 countries in the developed world, to move down the road of activity-based funding. And this has been in place in other countries for as long as 30 or 35 years, working to the benefit of patients and the payers who fund their care.
Yeah, and again, when we were in Sweden, we heard the same point, Nadeem, is that they are using this model over there. They seem to have a mix there between sort of the global budget approach, but also the activity-based funding, so that, for certain activities, there is that incentive to do more to help more patients rather than the current approach that we see here in Canada. So when we come back in a break, we'll talk about a couple other ideas for reforming our system.